India recorded a spike of more than 28,000 cases for the second consecutive day in the last 24 hours, pushing the tally to 9,06,752 cases with a death total of 23,727 on Tuesday. India crossed 9 lakh mark from 8 lakh within 3 days. India had crossed the 8 lakh COVID-19 cases on July 11. During the last 24 hours, 2,86,247 samples were tested as the testing lab network continues to expand. As on date, more than 1,194 labs have been enabled for people to undergo coronavirus tests. Maharashtra remained the worst hit state with 2,60,924 cases and 10,482 casualties, followed by Tamil Nadu with total of 1,42,798 cases, including 2,032 deaths. States with more than 10,000 cases include Gujarat, Uttar Pradesh, Rajasthan, Madhya Pradesh, West Bengal, Haryana, Karnataka, Andhra Pradesh, Telangana, Assam, Bihar and Odisha. In the last 6 weeks, the number of daily deaths and positivity rate has steadily risen. While June 2 to 7 recorded 7.14%, July 6 to 12 the positivity rate was 9.8% as per government data. The cumulative case fatality ratio in the country is currently 2.6%, while globally it stands at 4.3%. Though India's positivity rate was 6 to 7% in the first week of June with more tests, that's 1,180 tests on 1 June, 2,19,103 on 12 July, despite a usual weekend dip in tests, the positivity rate also kept increasing in 2 to 7 June week. The average positivity rate was 7.1%. Between 8 to 14 June, it was 7.6%. Between 15 to 21 June, it was 8.68%. Between 22 to 28 June, it was 8.5%. Between 29 June and 5 July, it was 9.5%. And between 6 to 12 July was 9.8%. Which means almost 10 out of every 100 people who have been tested is found to be infected with the coronavirus. Since tests dip in weekends, the positivity rate rises on Mondays. As per a common consensus, a positivity of more than 10% is an indicator that tests are not commensurate with the increasing cases. As per experts in epidemiology, the ideal positivity rate advised by the WHO and the Government of India is 5%. A high positivity rate is also indicative of higher infection at the community level. In the process, a large number of milder cases remain undetected. The Indian Council of Medical Research, that is ICMR, data states the country tested 2.48 lakh samples on Saturday, of which 24,850 tested positive. Telangana with 28.35%, Maharashtra with 22.16% and Tamil Nadu with 12.49% have the highest positivity rates in the country. Meanwhile, the number of people being found infected every day is rising steadily. As per COVID researcher Shamika Ravi, she has stated in her tweets that the current growth rate is calculated at 3.4%. At this rate, she says India will have 17.8 lakh cases, that is 6.9 lakh active by August 3rd. I need to reassert that Shamika Ravi has said at this rate of 3.4%, India will have 17.8 lakh cases, that is 6.9 lakh active cases by August 3rd. And she also advises that we need to invigorate containment strategy across the states. And we must pay special focus on Maharashtra and Tamil Nadu, which together account for 40% of daily new cases in the country. Shamika has also said, where are the daily new cases coming from? She says it's Maharashtra plus Tamil Nadu that contribute to 40% of daily new cases in the country. Karnataka and Andhra Pradesh higher daily new cases than Delhi. West Bengal and Uttar Pradesh and Bihar are more than 1,000 daily new cases. Post-lockdown, the growth rate of active cases has been persistent at 2.5%, and this must be reduced. That needs better containment strategies across the state, is what Shamika also states. She has also said The testing and tracing efforts are woefully inadequate in Maharashtra, which is a hotspot, and the state has reported very high positivity rate for months. Tamil Nadu, Gujarat and Delhi have high positivity rate, and she says here need more testing. Now coming to Odisha, Odisha added 543 new cases of COVID-19, taking the case tally to 14,280, while the virus death toll mounted to 74 with 4 more fatalities in the last 24 hours. According to the State Health Department, 3 out of 4 deceased were male and 1 was female. The deceased were identified as a 71-year-old male of Cuttack district who was also suffering from oral cancer, a 71-year-old male of Bhubaneswar who was also suffering from blood cancer, and an 80-year-old male of Ganjam district who was also suffering from diabetes and heart diseases, and a 40-year-old female of Khurda district. The state also reported death of a COVID-19 patient due to other health complications, taking the number of such deaths to 22. Of the total 543 cases detected from across 23 districts, a bulk of 188 cases have emerged from Ganjam, 87 from Khurda, 52 from Sundargarh, 39 from Cuttack and 24 from Rayagada. Similarly, Mayurbhanj and Keonjhar reported 22 cases each, Jagat Singhpur 15, Malkangiri 11, Kendrapada 10, Balasore 8, Baudh and Puri 7 cases each, Jharsuguda 6, Balangi 5, Bargarh 3, Dhenkanal and Sambalpur 2 cases each, and Angul, Bhadrak, Jajpur and Nayagarh 1 case each. The active cases in the state now stand at 4,929, while 9,255 persons have recovered from the coronavirus cases and discharged.